So a lot of concerning skin presentations, I think I probably would have had a fairly low threshold for seeking a second opinion, referring up to specialists such as the dermatologists or even sort of plastic surgeons, or even sort of such as skin cancer clinics, if I had a lesion that I wasn't sort of too sure about. And possibly the lead-on question from this may be, what would I sort of do now I've completed the course sort of for the skin cancer? I think I'm definitely feel more confident in the diagnosis and management of these skin conditions to myself. That threshold for referring, I think, is a bit higher now, and being more comfortable in my own ability to both diagnose and sort of manage any of these skin lesions.
So before the training, I was probably doing a lot more excisional biopsies. I was much more cautious of my approach. With dermoscopy training, I can be more selective in the kind of lesions that I excise versus something that might be fine with a shape biopsy. And also, I guess, probably having to do less referrals now because I'm more confident in diagnosing skin lesions.
So now that I've done this training, I think I'll be much more confident to assess lesions clinically and dermoscopically, and to also, start on the next stages like biopsy or treatment, and also being more confident in my referrals to specialists if I feel that that's necessary.
So one of the things that I hope to incorporate after attending the training today is both routinely and opportunistically trying to ask patients about their skin cancer, prevention, awareness, and whether they do perform their own sort of skin checks, and also trying to incorporate more of a systems-based approach into my own sort of practice and what we use at the clinic, with things like documenting through images, through body charts, etc., just to make sure we've got a bit more of a thorough approach and very objective in monitoring skin lesions and skin cancer.
So now I've completed this course. When we get back to my clinic, of course, I will use dermoscope more often. And also I may start doing like some more biopsies, and I'm going to feel like more confident by using the dermoscope and, by the knowledge I've got like in this course and all those things. So, I think that would help me in that way. So, well, of course, at the moment, we have lots of patients with, skin lesions. And, as I told you like earlier, I'm not feeling that confident to manage those lesions. Now, hopefully after finishing this course, and by using like dermoscope more often, I will get that confidence, to get into that, and then, start to take like biopsies and all those things, which would be really beneficial, especially in the area of work. I think there are not that many doctors who are doing like skin things. So it would be a great thing for me, also for the clinic. So, yeah.
So what will I take away from this? Quite a few things, I think. Firstly, just from a systems point of view, having a robust recall system in place, and I guess documenting system for any patients that I do see with skin checks, having a systematic approach to the patients that I do see, as well as making sure that they're coming back for their 6-monthly skin check or 12-monthly skin check. And then I suppose hopefully building I've realised the importance of building relationships with the pathology providers as well. They're the ones doing the histopathology, and that's another piece of the puzzle, I guess, to triaging these kind of things.
So for other GPs who are looking at applying and participating in the program, I definitely encourage them to do so. The online training as well as the workshop today have been highly valuable and provided me with some good confidence and good skills that are going forward that will serve me and my patients.
I think the patients will have less unnecessary excisions. The excisions or procedures that they do have will hopefully have better cosmetic outcomes. They will have better wraparound support around the skin consultation with regards to sun smart education and follow-up of future lesions and wound care.
Definitely. I think we should empower every GP to have a dermoscope and be dermoscopically smart to see his patients, and they may have multiple places that are easily accessible for everyone to have the skin checks done regularly. Yeah.
So, being a GP in a regional area outside of Geelong, we have a shortage of all sorts of specialists, and particularly in the Geelong region, we have a real shortage of dermatologists. It's really hard for patients to get in to see a specialist, and whether it be a dermatologist or a plastic surgeon, it's also costly, or there's a really long wait in the public system. So, I think coming to a course like this is great. It's great for general practitioners to be able to be more confident, and also, better at early pickups of skin cancers, being able to confidently assess and diagnose skin cancers, and then, treat more of them ourselves in-house in a clinic or a situation where patients are comfortable and it's easy for them to get to, etc., rather than have to send them off. So I think, being able to do more as a regional GP is really important, and so being able to upskill in a course like this is fantastic.